All right, 2 weeks postpartum. We have a whole episode about baby stuff, what to expect with your 2-week-old. You can see they are kind of waking up a little more. I always say just give them 2 weeks and they really start to wake up and things get more interesting. So, hi, Blue Eyes. Hi. We've had a good 2 weeks. I'm going to pass you to Dad. We're going to go try to practice a nap in your bassinet. 2 weeks is, I feel like, I always tell everybody, you're going to kind of start feeling like yourself again around the 2-week mark. At least I do. Like, your bleeding is slowing down. Your pelvic floor sort of feels a little less like it's falling out every time you stand up. And so kind of that 2-week mark, I feel like, is where you sort of start to turn a corner a little bit in terms of like the acute physical challenges are hopefully starting to improve a little bit. Like, I feel like around the 2-week mark, I switched from like the big mesh stretchy undies and the giant pads to like my undies and like slightly smaller pads. I got out of the shower the other day and was like bleeding all over, and Kurt was like, "You're still bleeding?" And I was like, "Yes." This is the most glamorous, magical time. Yes. So your bleeding does get lighter as you go, but it's very, very normal to still have some bleeding at that 2-week mark. Other things that, around that 2-week mark is often when your support leaves. Maybe grandmas are around for that first week, or you have people who come and visit and people are bringing you dinners because you just have this fresh baby. And it always seems also at that 2-week mark like you're on your own. The food is run out, the Grammys are going home, and so now you're really just doing it. And as it's wonderful because you kind of get to establish like what's your normal routine. Oh, there aren't people at our house anymore, like this is our new family. But it also, baby starts to wake up and not be kind of like sleeping all the time. And that fatigue of caring for a newborn and being up every 2 hours to feed the baby and different things also starts to kind of hit you. So I'm definitely ready for a nap here. So anyway, other things that at 2 weeks in terms of thinking about kind of your boobs, your bottom, usually at this time, your nipples are hopefully starting to hurt less. Usually around that somewhere between 2 and 3 weeks is where I feel like I don't have to wear my silverettes anymore. My nipples are doing okay. Baby's latch is better. We're getting better at this. I don't have these funny shaped looking nipples anymore when I go everywhere because I can take the silverettes off. Now, if that's not the case, you still feel like you have really sore nipples, this would be a time to find a good lactation consultant, talk to your pediatrician if they know someone in the area, to really be working on establishing good breastfeeding habits, getting things so that you have a successful breastfeeding journey. It's not too late. We are 2 weeks into this. Definitely that is potentially still an area of improvement. I guess with Cease, we were still really on the struggle bus at 4 weeks. So I might have still been wearing my silverettes at 4 weeks with Cease, but I'm about to think I don't need them all the time now at 2 weeks here. What else? This is around the time when we start introducing a bottle to babe, just because I am going to go back to work. My kid has to know how to drink from a bottle. It's fun for Kurt to give the baby a bottle. It's just like a special time to get to feed the baby. And so it's usually around somewhere between 2 and 3 weeks when we say, hey, let's let this wee one try. We have a whole video on paced bottle feeding, which is really, really important for breastfed babies. The type of bottle is important too. You want one that mimics a nipple. Let me go get the one we like. So it's around this time we introduce a bottle. The two that we've tried so far are the pigeon bottle. So you can kind of see this very triangle shape. It's not like a big ball here. This is supposed to mimic a nipple. Lactation consultants love this one. Also tried a cork. You can see it's all kind of about this nipple shape. And always, always, always using a slow flow nipple, because again, if you're breastfeeding, these are things that are really important. If you're breastfeeding, you don't want baby just getting a hose of milk. You want them to continue to have to work for it, like they have to work a little bit at the breast. Other Dr. Brown's, Lancino are other really breastfeeding friendly bottles that we've used. We've used Comotomo in the past and our kids did fine. It's technically not like a breastfeeding happy that the lactation consultants necessarily love. Our kids have done fine, but it is in between 2 and 3 weeks when I will pump for one feed and then Kurt gives them a bottle, just for practice for everybody. Sometimes there's bottle refusal and different things like that. We haven't experienced a lot of that just by introducing them pretty early to it, and they go back and forth fine between breast and boobs. So I do notice after Hank has a bottle, that next feed, he's really chompy at the boob. And so it's just a thing that they have to practice. And if you need help, again, find a good lactation consultant. Talk to your friends about tips and tricks. Come check out things here. I will say once we get to that, hey, we're giving baby a bottle and hey, I'm going to be pumping, I switch from like some of those cuter nursing bras to just the staple pumping and nurse bra. I'll link my favorite. It's sturdy. It keeps the pumps on. There aren't like the 2 straps up here. It's just one. It might be Mom Cozy. I'm not sure, but I'll link it. I find them on Amazon. They're not expensive. They're very comfortable. They've lasted through 3 kids here. Sometimes the pump and nurse bras have like a 1 snap for the flange thing and then another snap for kind of pulling the bra part over, and I find those get kind of annoying and bulky. Certainly much cuter, but these pumping bras here are just great. So I will link that for you guys. And then what else? In terms of exercise, your pelvic floor, again, at the 2-week mark, I am doing gentle breathing, leg extensions, like very simple, thinking about connecting the core and the pelvic floor, walking 5 to 10 minutes a day. And that is it. So, as I said, I feel like at this stage, we go from like the giant hospital mesh undies and the giant pads to like, just like a regular size pad. As I've said before, I really like the ones that are kind of organic cotton topped. Some of the synthetic stuff just doesn't feel really great. So fragrance free, organic, like a cotton top is really nice. In terms of favorite nurse and pump bra, check out this sexy thing. It looks like this. Can you see the design of it? You can kind of see the design of how the flanges go. You just kind of sneak them in right here. There's only the 1 snap to then be able to access for nursing. I guess maybe this is easier. Isn't that just a cutie? Isn't that a cutie? So you sneak your flanges in here and then just 1 snap and you can access for nursing. So once I'm at the, hey, we're going to pump once a day and try to give baby a bottle, living in a pump and nurse bra, because no one has time to change their bra. In comparison to like, look how cute. This is so cute. Like, cute back, pump and nurse, but we have the first snap. Whoops. Oh, I don't even have everything snapped. There's so many snaps. There's snap 1. Here's snap 2. So it's just a lot more. There's just a lot more going on with this. Okay. So here's the bra. Very cute. Sporty. Sweat and milk, maybe something like that. I'll figure out what it is. But you unclip the first one if you want to pump, because then here is your pumping part of the bra that would hold a flange. Okay. And then if you want to nurse baby, you take down this second snap to be able to get to boob access. So then to put that back up, snap 1, snap 2. I believe in me. There we go. Voila, another pump and nurse that I like. Obviously, it's like a little cuter, but it is just has a little more going on. So, like the one other thing that's here is like nursing clothes. This is a nursing shirt. It's got 2 layers. So basically I lift this up and then there's this under layer here for easy access. I've really liked it this time. It keeps like this second layer underneath then keeps belly covered and it's not just like massive amount of chest here because it's got this top. So kind of, we've just been out and about a bunch. Nobody really knows that your boob's completely out. So I have enjoyed that. These Beyond, I think it's Beyond Yoga. They're super soft. They're definitely a splurge. I have 2 and love them. I just ordered another like similar, that 2-layer thing from Latch Mama. I'll let you know what I think about those. Just trying to find good stuff that makes it easy to nurse when you're out and about. I will, like, this is a time where we kind of we're keeping an eye on mood, postpartum blues, anxiety, things like that. I certainly get I have a little anxiety. Some of that is like protective of your baby. I'm just like, what if my water bottle falls on his head? Or what if I trip when I'm carrying the baby down the stairs, or little things like that? Normal. If these thoughts become intrusive, if they are making it hard for you to get through your day, if you are crying all the time, if you do not find that you are able to enjoy your baby, you're just totally overwhelmed, call your pediatrician, call your OBGYN, talk to your partner. Letting your partner know how they can help you and really open communication is great. Sometimes it's hard to know what you need. And so if they don't necessarily see what needs to be done and do that, try to help have that conversation together. But you're getting into the grind of, hey, we have a newborn. This is exhausting. It's wonderful, but it's a lot of work. And how do we thrive, not just survive? We do lots of contact naps. I've got the wraps out, so that's been really fun. And I will say, when I look at my app in terms of feeding, I use the Huckleberry app to like track breastfeeding. And I will say that some patterns are maybe starting to evolve of like maybe where baby's going to want to eat. So in the future, when we're starting to think about like a schedule or routine, like a flexible type routine, maybe I'm starting to see some patterns evolve here, but just trying to keep an eye on that. And in terms of your bottom, again, many times you need stitches, different things like that. Totally fine to take a bath if you're a bath person. No swimming still in dirty water pools, things like that. Clean, hot bath, totally fine. Making, your stitches, if you got stitches, are going to dissolve on their own, but still making sure you're having nice, soft poops. So Miralax, potentially, as some people find it's helpful if you support your perineum when you have to have a bowel movement, just that support helps to keep your it's just like if you have a C-section and you're going to cough, you kind of hold that. You can hold a pillow or hold your hands on your C-section incision to kind of support it. Same thing when you're pooping, you can kind of support your perineum when that pressure is on your bottom again. Generally though, that is starting to feel better at this phase. I'm not sitting on an ice pack anymore. That first week or so, I'd sit on a padsicle 3 times a day. I was taking Motrin every 6 to 8 hours just to help with pain and inflammation. And now in this second, going on to 3rd week, again, turning the corner, not feeling like I'm needing that anymore. And so hopefully that is true for you. If you feel like things are going the other direction, things are becoming more painful, your bleeding's increasing, you have foul-smelling discharge from your vagina or your C-section incision, those are absolutely things to talk to your OBGYN about, because generally it's kind of wild, but baby is born and then you have a 6-week postpartum visit, and often offices will check in, a nurse will call to check on you, check on your mood, check on your symptoms. But if they don't, these are just things to look out for, and don't hesitate to call them if you feel like something just isn't going quite right. If you are not turning that corner, reach out for some help. So we will check in with another vlog here in a couple weeks to see how the surviving and thriving is going when we get to that 4-week mark. I think it's nap time for everyone. Have a great week. Bye, guys.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.